clinical toxinologist and herpetologist working on improving the treatment of snakebite in Papua New Guinea. He is head of the Australian Venom Research Unit in the Department of Pharmacology and Therapeutics at the University of Melbourne and also heads the Charles Campbell Toxinology Centre. He collaborates with a number of international colleagues on issues relating on improving snakebite treatment, venomous snake systematics, venom proteomics, and antivenom development. I would like to request Professor Dr. David Williams to be here on the stage, please.
Right Honourable Madam President, Honourable State Minister for Health and Population, dignitaries, ladies and gentlemen. Every year, snakebite claims 138,000 lives worldwide and leaves 400,000 more permanently disabled. Conservatively, as Professor Worrell said, at least 100,000 deaths occur in South Asia alone. Most of these people are poor, disadvantaged men, women and children from the world's most impoverished communities. They're people just like you and me. They're men, women and children with hopes, dreams and aspirations. They're parents who make sacrifices every day to help their children have better futures. Children with untold potential. They might be future farmers, homemakers, teachers, doctors. They could become world leaders. The possibilities are endless because history teaches us time and time again that often the greatest people among us come from the most humble of beginnings. Yet every 4 minutes, somewhere in the world, another person dies from the bite of a venomous snake. And indeed, for decades, the plight of snakebite victims has failed to attract the attention of public health authorities in the same way that the suffering of those affected by other diseases has. As past UN Secretary-General, the late Kofi Annan, once said, snakebite is the biggest public health issue you've never heard of. But in the last 4 years, the tide has indeed begun to turn. Advocacy and political engagement by the Global Snakebite Initiative, Médecins Sans Frontières, Mr Annan and many others has led to recognition in 2017 by the World Health Organization that snakebite is a neglected tropical disease. More recently, our efforts in highlighting the devastating impact of snakebites and mobilising governments to work together resulted in the adoption of a robust resolution directing comprehensive measures to address the problem by the 71st World Health Assembly in May of last year. This strong mandate to WHO delivered the political support for action that until now had been lacking. In his capacity as a director of the Global Snakebite Initiative, Professor Sanjeev Sharma, who will be talking to you very soon, has played a substantial role in achieving this very important outcome for the victim of snakebites, both around the world and here in Nepal. Along with myself, Professor Worrell and other experts, Professor Sharma was also an important senior member of the WHO Snakebite Envenoming Working Group. And we were very pleased indeed when at the 72nd World Health Assembly in Geneva this past May, the WHO launched its own strategy for the prevention and control of snakebite envenoming. This comprehensive roadmap takes a strong holistic approach to reducing the burden of injury. Indeed, it aims to use community engagement, improvements to health systems, access to safe, effective treatments, and broad collaboration and partnership to cut deaths and disabilities by 50% by 2030. It is a pragmatic and practical plan with realistic expectations, and it has wide support. At the centre is the aim of integrating improved management of snakebite within national health plans and into the overall effort to achieve universal health coverage and to meet the Sustainable Development Goals. It is a plan that focuses on building local capacity and building local and regional cooperation to create sustainable solutions. It leverages technical support and global coordination from WHO and calls on all stakeholders to collaborate and cooperate to deliver and implement sustainable solutions. And the reality is, snakebite is an eminently treatable disease, but it is multifaceted and it does require a coordinated, multidisciplinary and multifactorial response driven by clear leadership and commitment from government and supported robustly through broad engagement with stakeholders. At a minimum, we must improve epidemiological surveillance. Snakebite should really be a notifiable disease, and reporting systems should be standardised and interlinked within countries, regions and globally. Access to safe, effective and affordable treatment must be guaranteed. Antivenoms manufactured according to internationally accepted standards of good manufacturing practice and designed appropriate so as to be fit for use can save many, many lives. But the control and regulation of antivenoms must be strengthened. Manufacturers and scientists must start to collaborate to improve the design, quality, safety and effectiveness of current products. The days of accepting products with 50 to 80% adverse reaction rates should remain licensed need to end. The industry has to clean up its act. And thankfully, many manufacturers are already taking valuable steps to direct and more to follow. But at the same time, manufacturers won't risk improving these products without the surety that governments and procurement agencies will pay a fair price and ensure sustained markets. And health systems must be strengthened. Medical personnel must be trained. Resources for diagnosis, acute and ongoing care must be available. And more importantly for victims, rehabilitation and the hope of returning to a productive life must be assured. No person should be discriminated against because of disability, and no person should be condemned to a life of poverty through snakebite envenoming. I look forward to 2 days of productive and proactive discussion, and I hope to have time to speak with many of you individually. And I hope that recommendations that can come from this meeting will result in Nepal taking up the WHO's new snakebite envenoming strategy and becoming the first country in the region to use this roadmap as a blueprint for implementing its own snakebite prevention and control program. Thank you.